I think racism, maybe if it was talked about more in the context of mental health. What's your thinking on that conceptually, and are you frustrated? It's not often talked about in that framework.
Culture and race comes into psychiatry as almost an afterthought. And the obsolete, antiquated, and self-destructive nature of racist, prejudiced perspectives is underappreciated in psychiatry. It's not addressed so much. It's not a symptom of anything. There is a cultural formulation that was proposed by Roberto Luis Fernandez and others that was never really used. My kids, we live in the whitest of lily white suburbs, which I chafe at, but I told my middle son that he likes to talk about racism. He said, well, that's racist, that's not racist, that's racist, that's not racist. And when I talked to him about the concept of us and them, how that is part of racism. We are good, they are bad, white is good, dark is bad. All of these tropes that have oppressed millions and millions and continue to. He really didn't understand it because I think he lives in such a homogenous society where he doesn't have to. And whether you're an African-American in a predominantly African-American neighborhood or a white person in a predominantly white neighborhood, without the exigency of confronting the other, I don't know if you can become more aware of your own racism. I don't know if I think about it quite as a mental illness as much as I think about it as kind of inherent to the human condition in tribally defining us v. them. The perpetuation of tribalism is a bummer, man. I had an African-American patient who was paranoid, and he was targeted by his school, essentially. And, it's not paranoia if they're actually trying to get you.